Welcome to another Inside Lyme Podcast. You are listening to a show dedicated to discussing actual cases. Dr. Daniel Cameron has been treating adolescents and adults for more than 30 years. He feels that the best way to get to know Lyme disease is through reviewed actual cases. Please remember that the advice given is general and not intended as specific advice as to any particular patient. If you require specific advice, then please seek that advice from an experienced professional. Now please welcome Dr. Daniel Cameron.
Welcome to an Inside Lyme case study. I'm Dr. Daniel Cameron. I will be discussing two travelers who contracted Babesia while traveling to the United States. Kwon and her colleagues first discussed this case in the journal Korean Journal of Parasitology in 2018. The first woman was a 50-year-old housewife who was admitted to a hospital in South Korea with a fever, abdominal pain, and nausea. She had visited a forest in New Jersey in the United States 4 weeks earlier. She described a reddish skin lesion on the right proximal calf area that was suspicious for a tick bite. 2 days later, she developed a headache, muscle soreness, fever, and chills. If she had remained in the U.S., doctors would have suspected Lyme disease, but now she had traveled to South Korea. In South Korea, doctors are more likely to suspect malaria, since malaria is endemic to the northern provinces of South Korea. She had a blood smear suspicious for Plasmodium species and an infarction of her spleen. Plasmodium is responsible for malaria. She was treated with hydroxychloroquine for malaria. The subsequent blood test did not show malaria. The doctors looked again at the blood smear. 4 Plasmodium-like organisms look like a Maltese cross, which has been seen in Babesia. This is a ring-like structure in the red blood cells in a tetrad form, which resembles a Maltese cross. And this is pathognomonic. That says Babesia. The PCR test was also positive for Babesia. Babesia microti is a parasite carried by the same deer tick that carries Lyme disease. The woman was treated for Babesia. Her fever, abdominal pain, and lab findings resolved within a day of treatment. The second woman was 72 years old. She was evaluated at the same hospital in South Korea with a fever of 99.9. She was moderately anemic with a hemoglobin of 10.8 grams per deciliter. Her platelet counts were low, her C-reactive protein and sedimentation rate were high, which is consistent with some kind of inflammation. Malaria-like organisms were described in her blood smear. Her malaria antigen test was negative. The doctors looked at the blood again. The doctors found again a maltose cross forms in the red cell, the same forms described in the first woman. The doctors diagnosed the patient with Babesia. The doctors prescribed atovaquone 250 milligrams combined with proguanil 100 milligrams and azithromycin. These medications are marketed under the name Malaria and Zithromax in the U.S. Her medical condition worsened. She developed a fever and her lungs were congested. Her treatment was changed to quinine and clindamycin. This combination has been used for severe cases of Babesia. This combination has more side effects than atovaquone, proguanil, and azithromycin. She also had her red blood cells exchanged. During her red blood cell exchange, doctors removed abnormal red blood cells and replaced them with healthy red blood cells derived from blood donors. Her condition worsened. She was intubated due to respiratory failure. Doctors added doxycycline for possible co-infection with Lyme disease or anaplasmosis, since anaplasmosis has been described in the area that she visited in the United States. Tests later confirmed the woman had a concurrent infection with Lyme disease. Both the IgM and IgG Western blot tests were positive for Lyme disease. She died 31 days after being admitted to the hospital. Only 8 cases of Babesia infection had been reported in Korea, 7 of which were imported, notes Kwon. That is, they came from another country. Kwon cautions both clinicians and travelers, quote, As the population of traveling abroad increases every year, both physicians and travelers need to be acquainted with not only endemic diseases of their provinces, but also those of other regions. In this case, the Lyme disease, Babesia, and anaplasmosis in the U.S. What can we learn from this case? Babesia can mimic malaria. The onset of Babesia can be delayed. Both of these women develop Babesia weeks after travel to the United States. And as the number of travelers abroad increases, it is important to be aware of tick-borne illnesses such as Babesia. What questions does this case raise? How often are travelers contracting Babesia and other tick-borne infections while traveling to the United States? Is there a way to properly recognize Babesia in an area endemic for Lyme? Would early identification of Babesia and Lyme disease in the 72-year-old woman have prevented her death? Many patients are complex, as highlighted in this Inside Lyme podcast series. We need more doctors with skills diagnosing and treating tick-borne infections in travelers. We hope that professionals evaluating travelers can use this case to remind them to look for tick-borne illnesses and treat accordingly.
Thank you for listening to another Inside Lyme podcast, a show dedicated to discussing actual cases. Keep in mind, the notes for this episode and all episodes can be found on our website at danielcameronmd.com. Sign up for our newsletter to keep up with our cases. As always, it is your likes, comments, and shares that help spread the word about this podcast and our work. If you can, please leave a review on iTunes or wherever else you get your podcasts. Until next time on Inside Lyme.